So I have 6:15, so I will
We
call
all
this
receive copies of
meeting
the
to
minutes. I
order.
think they were delivered to our offices.
Yes.
Are there any changes, any questions on them?
No questions here.
No?
Accept the minutes?
Yeah. Second?
I'll second it.
Okay. Any
That's
further
okay.
discussion? All in favor?
Aye.
So Sue, looking at the outgoing correspondence, there's really nothing there. What about the lifeguards? Did Mark look at everything?
Yes.
So Mark,
The letters should be in here under outgoing correspondence, the
Yeah.
letters that I sent to the different condo associations,
right.
basically
Mark went
saying
through-
that their lifeguard variance, the weekday variance was approved.
But Mark went through the packages and checked off all the criteria.
Yep.
Okay. Because we don't have the packages in front of us for us to.
Right.
be
No,
able
he
to-
checked off everything. And at last month's meeting, the Williamsburg 1 condo was still missing a couple of documents. And so at last month's meeting, you had approved it pending receipt of those, and Mark received those on June 30th. So that's why their letter is dated July 1st versus the other two, it's dated June 1st.
So they've held off opening the pools
Mhm.
later than usual because of the COVID, I imagine? Okay.
Yeah.
All right.
Yeah.
All right. And then we've got a lot of Board of Appeals stuff here.
Yeah, so that's just the stuff that comes across my desk. Anything that is going on in Chelmsford as far as, additions, renovations, anything like that, that requires people to go before the Board of Appeals for a special permit, comes across our desk so that we can look at them. And most of the time, there really aren't any comments or concerns that I have regarding the different, construction projects. And the only one that I did have, if you look through this group, the only one that I did have concerns about was the 1 Billerica Road and 44 Central Square. Written the letter to the Board of Appeals because in their initial plan, so if you look at the first letter, you got all of these, document centers and views that you can go, and it shows all the different plans and the breakdowns. And essentially, when I look through it, they only had one dumpster in that entire complex, and they plan on having a restaurant in there. And so one dumpster was not going to be enough to include, the 5-story building as well as the other buildings. So my
And the 8 apartments.
Right.
Right, yeah.
So it's the apartments, and then the other one with the, it's apartments, a restaurant, and then a second 5-story building. So one dumpster pad with only one is not going to be enough to serve all those people. So that's why I wrote that letter.
Okay. And did you get any response?
No.
Okay.
That one, what day there? Yeah, so that one was heard on June 24th. So I don't usually get a response from when I write the letters, but for the most part, typically what they do is with our recommendations and the reasons that we give, they usually abide by them and tell the person or the developer that they need to implement that change.
Okay. So is there any other comments from anyone regarding the outgoing correspondence?
No, I don't have any. That's a big project, but I haven't seen any of it, so that's fine. That's fine.
I think the Groton Road project's bigger, isn't it?
The Groton Road is
duplexes.
yeah, 12 of them, I think. And then
11.
The 11 that they're building, and then there's an existing house, so it's going to be, I think, a total of 24.
And that's pretty big. Okay.
Motion,
Now,
sorry.
no, this piece of land, is this taking up all the land that was of dispute to be developed under that thing up in that same area?
It's just the one side of the road. So if you were going
To the left side, heading to
yeah.
Westford, the left
Yep.
side? Okay,
Yep.
so there's still the issue of what might happen on the right side?
Right, well, and based on the vote from last fall's town meeting where they were gonna get that grant funding to do the studies along the different intersections of Route 3 and what would be best suited for those areas.
Right.
So my understanding is they're gonna wait for that study to see what's recommended along those interchanges and then go from there.
So they're not going to do the,
I think this has been going on, this other development, for quite some time.
Yeah, I think you're right.
He's been gathering up parcels of land
right.
to put this together.
Yep.
Okay.
And I
All right.
think
That's all I had.
initially, I think it was going to be some sort of a mixed use, but it looks like he's just gone into complete residential.
Yeah.
All right.
Because they didn't change the zoning along there.
Right.
Okay.
Oh, that's right. All right, anything else on the outgoing correspondence, gentlemen?
No.
No? Can I have a motion to accept it?
Motion to accept out.
Second, Richard?
Yes, second.
No further discussion. Can I have a vote, please? All in favor?
Aye.
Anyone opposed? No?
No.
Got the incoming correspondence now. And Sue, they're still doing the mosquito spraying, right?
Yes, so people can still go on to the Central Mass Mosquito Control website and they can, ask for their property to be evaluated and have them come by and spray. So they are still doing that. This is the most recent communication from them that gives us the dates as to when they will be in Chelmsford for the month of July. And Donna has put this on our webpage so that people have access to it there. And then the document right behind it is also from Central Mass Mosquito Control about a program that they have for people with abandoned swimming pools. And I thought this was very interesting. And Rich, you would know this better than I would. I don't believe that I've ever seen a letter like this where they would treat the abandoned pools. Maybe they did, and it was just not really, they didn't advertise it. I don't know.
No, basically, usually the individual, let's say Jay, if he was the one that was in town, would spot these things and approach them or approach, in this case, me, and basically sit there and say, hey, when I drive by, do you want me to throw a few pellets into the pools that have been, basically walked away from? And I'd say, yeah, do it. Can you,
Okay.
you have a good baseball arm. You can actually stay on public property and throw it, but
It's
without
still trespassing, Richard.
Well, what, for throwing a pellet into the water of the pool?
Yes.
Yeah.
Okay.
And then
Well,
But it never happened, right, Richard?
No, and also too, fine. Then what would happen is I'd go out and find the pool breeding, and then I'd have to cite them and find them.
Yeah.
That was the scenario. So it was
No.
like, instead of chasing everybody around, which you're not going to find for a long time.
Yeah.
So,
I get it.
yeah.
So on the mosquito spraying, can a resident ask to have it done more than once?
Yes.
Oh, okay.
So each time you want to have your property evaluated, you just have to go back on the website, fill out the form. They come out typically when they're in the area, they'll assess your property. If you're not home, they leave a card on your door that usually says when they're going to come, and they, on the card it says, keep your windows closed, that type of thing. And just as an FYI point, I got my first email today from the state, and there was a webinar last week where they were talking about beefing up their efforts as far as follow-up on testing mosquito pools across the state. So they have strategic areas across the state where they set up these mosquito pools, and this year because there were 12 cases of triple E in Massachusetts last year, which was the highest case number in a while with 6 deaths. They're beefing that up this year. And I got a notice today that they had their first mosquito pool in the state. It was in the Athol area. So not in our area, but this is actually early in the season for them to find a positive mosquito pool. So they're essentially want us to help educate people on the fact that they really need to start early. Right now is not too early when you're outside using the repellent, you know, stay up indoors at dusk, wear long sleeves, protect yourself, that type of thing.
Okay.
Question about the abandoned pools, or 2 questions actually. First of all, how many do we have? And the second question is, these, I'm hoping that they are still gated off, that the kids don't have access to fall into them.
So I don't know exactly how many we have, because the only way that we would know that is if somebody called our office to complain that either there was a vacant home next to them and there was an abandoned pool on the property, or, you know, my neighbor has a pool, they haven't opened it in 5 years, and, you know, I want you to check it out. In which case, typically what we do is we collaborate with the building department on that, and we find out if they've got a permit for it, that type of thing. And then if it is an abandoned pool, we would reach out and we would say, if you're not going to open it, this is what we would recommend. And per the building department, they're the ones that enforce, like the fences and all of that.
Okay. And with regard to the rabies, the brown bat, it says exposure type other.
Unfortunately, that is all the information we get, is what's written on these reports.
And I believe that from a medical perspective, if there's just a bat in the house, that qualifies as an exposure, because
Correct.
teeth are so sharp that you don't necessarily know that it bit you. So
Right.
that a house, it's not specified.
No.
Yeah.
And I don't think any of these, if Nick were still on the board, he'd be very disappointed, because none of these have names.
Wait a minute. Something's got a name Boxer here.
That's just the type of dog.
Oh, I thought that was the raccoon's name.
Yeah.
What is the, oh, I see. So the raccoon, there's a Tufts Wildlife Clinic in Westboro, or sorry, in North Grafton. But I assume that the bite, I assume was a bite occurred here.
Yeah, it looks like it happened at the Newhouse Wildlife Rescue.
Gotcha, okay. So the raccoon bit the dog and the dog was taken down to Grafton, to North Grafton for the wildlife. Okay. Okay.
The pool, both of the ponds have been tested and we're okay there?
Yes, so we tested them right after the kids got out of school, well, finished their remote learning. And we had lifeguards started on the 20th of June, so we tested it before that. And then we tested it again the last week. We did not test it last week because you can't test if it's been raining, and we had so many days where it was raining at night that it was not tested last week at all. So Mark went out today and tested it this morning.
Okay.
Have we had to close down either of the beaches again this last month?
No.
Okay.
You mean in relation to the testing, or?
No, in relation to people congregating in dense groups.
No.
Thank goodness.
And, I think, I don't know if people are not complaining because they realize that, we have the sign posted that if necessary and if we're absolutely forced to, we would have to close it down again, which of course is not what we want to do. And, hoping that as each phase of reopening occurs, that people are just following the guidelines.
And the steward down at Hart Pond has not been harassed anymore? that we've heard about?
No, not that I know of.
Okay, good.
If I could, I was going to add a piece of information when you were talking about the mosquitoes. I don't know if all the board members know that I'm still on the commission, Central Mass Mosquito, and I'm the chair of the mosquito project. And that also too, that one of the things that the project is, they're not officially saying or doing anything, but one way to get the most efficient control of mosquitoes around your house is to get your abutting neighbors to what I call sign in at the same time you are, so that they'll come out and they'll do a cluster of homes, and therefore everybody gets a better result from the spraying, of the mosquitoes than individual homes. So they are very, very, very happy to see multiple numbers of people on a street or in a neighborhood or whatever sitting there saying, yeah, geez, I heard from my neighbor that, so I'm calling too. And that way they can do them all at the same time. It's more efficient, but it's also more efficient for you.
Yeah.
My neighbors love you.
Well, I've been on the mosquito thing for 27 years, whatever. So, yeah.
So what happened up at Morocco Drive?
It was a hazardous spill that they, just basically refer to it as an oil or other hazardous spill. So it gets reported to DEP, and then DEP basically says, the current owner has to file with DEP a remediation plan and what they're going to do to.
This is at the trailer park, isn't it?
It's
Yes.
within there, yeah.
Okay.
And is this the same spill that we heard about the spill last month?
Yes, so this
Okay.
is just more documentation. So if you look at, like, even though this came late, it's dated May 7th, a kerosene release at 70 Morocco. So that's a letter from Clean Harbors basically saying that they were hired to fix the problem.
Okay.
And then, the next page is actually the DEP release notification form, also related. They're all related to the same spill. It's just the different notifications from the different people.
So we were talking about One Billrica Road, which is that restaurant and apartments, condominium development. But there also seems to have been some sort of a contamination at that site.
Right. So, and the thing is that all they really say to us is, if you look at this front page, it says that there has been a release of oil or another hazardous material at the property. And if that happens, they have 121 days to report it to DEP. And then DEP responds to them, lets them know that it's their legal responsibility to remediate the problem and what they have to do in order to take care of it. And then once they do that, they submit it again to DEP and it gets filed. So that's where they're doing some of that construction, right? That one, it's the combination of One Billrica Road and what's the intersecting road? Central Square?
Central Square, right, yeah, it's the Fisk Building
Yeah.
property.
Yeah.
Really
So
strange.
that will all have to be remediated before, they'll be able to move forward with all of their permits and stuff.
Well, it may have become evident during the transfer of title.
Right, that's what I'm thinking.
Yeah, somebody did a testing and found it.
Mhm.
All right. All right, anything further on the incoming correspondence?
Motion to accept?
Second?
All in favor?
Aye.
Anyone opposed? No? Okay. Old business, Sue, you're going to give us a COVID update?
Yeah, so as most of you know, and I think a lot of, people in the public know, that the governor announced last Thursday that today was going to start phase 3 reopening. He made it perfectly clear that unlike phase 2 that had part 1 and part 2, that he's basically saying that phase 3 is going to have multiple steps within it. I'll be honest, I'm still familiarizing myself with all of the different places that can open and what's required and what they can and cannot do for this particular phase. And, we're getting lots of questions, lots of emails from different people who, they want to do the right thing and they want to make sure that if they are reopening and when they are reopening, that they're following the guidelines. So there's a lot involved with answering the phone calls and answering the emails. What we did recently is we decided to start tracking the number of complaints that we get. So totally separate from just providing people information and guidance, we're tracking the number of complaints that we get. So for the month of June, we were able to track 69 complaints that we followed up on, but that's number 69 does not count the individual emails that any of us may have received. So I might get an email complaining about a certain place. Mark or Michelle could get a separate email. They don't necessarily email all of us. So what we're implementing for the month of July is that anytime any of the individual staff members get a separate email, that we send it to Donna so that she can log it so that we can just track the numbers. We've really been doing well, knock on wood, with our cases. They've been pretty much holding their own. We have 337 confirmed cases at the current time. Of those, now that goes back to, as far back as February 1st, all total. Active cases that we have currently is 47. From the beginning, we've had 26 probable cases and 42 deaths, the numbers that we have at this point. So we're hoping that, things continue to settle out. We just actually got some new guidance today. Well, it might have come out on Friday from the state, and they were talking about people who test positive and are a confirmed case, and they go through the 14 days of, the 10 to 14 days of isolation, their symptoms go away and they get better. They basically are saying that you can test positive for up to 6 weeks. So they are recommending that people who are positive have finished their isolation do not consider getting another PCR test until it's been a minimum of 6 weeks. However, and the antibody test, if they go and get an antibody test and their antibody test shows a positive result, they're now saying that there's evidence that that antibody result / immunity is not lasting that long. So it's not as if once you've got it, you have this long-lasting immunity. That's what they're indicating at this point. And what they're saying is, if it's been more than 6 weeks since somebody tested positive, they got completely better, all their symptoms went away, and then all of a sudden at 8 weeks, 10 weeks, they get symptoms again, and they get retested, and they test positive again, that at that point they would then have to go back into isolation. So that's been a change from before, because they originally told us once somebody tested positive, they did their days in isolation, they would not have to go back into isolation. So that's a change. So we'll see what happens with that moving forward. But all of the numbers, you know, across the state are good. We're doing, thankfully, you know, when you look at what's happening in other states where they're exploding, thankfully we're not. Our hospital's doing good. Dr. Miko, I'll let you talk about the hospitals because I think you have a better idea of that than I do.
I was going to ask a couple questions first. So that we have about 50 more cases above and beyond what we had last month at our meeting, that we went from 317 to, like you said, 365 now?
337.
Oh, okay, so we have 20 more cases. That's a lot less than we have had the last couple of months. And the current cases have dropped from 55 down to 45, but it lasts long in some cases. With the testing, there's various forms of testing. There's been problems that some of them are a little bit, you know, better than others at picking it up. With a PCR test, it's looking for the RNA, and it's like you can get like DNA out of like the teeth of people who died 400 years ago. And that's part of the problem with doing the PCR test, is that even if you've gotten better, you can still pick it up. And the problem with the antibody testing is that even if it's positive, it doesn't necessarily mean that you are not contagious. It does not mean that you are protected. And in terms of the duration of any protection, that's the debate that they're getting into now that you're talking about, saying that if you become sick again, they're going to assume it's a new case and you're going to start from scratch based on the clinical criterion. With regard to the hospital, I think they had outfitted the facilities over at UMass Lowell, and they've since taken the equipment out of those facilities. They've shut down. We have our tents back. Is that correct?
Yes.
Okay.
Yes, we do. Yeah.
So they're starting to do elective procedures. The number of people on ventilators has consistently been below 10, whereas it hovered about 25 for about 3 months. And the total number of inpatient cases that are either confirmed or presumptive COVID is something in the teens these days, which is a lot, which is far down from where it was, about 3 times that amount for about the 3 months. So we're looking good locally. I do have to sort of say that every night when you look at the national map and you see what areas are going up, there's states like Vermont that if they go from 0 to 1, it's an increase of 1,000%. So I'm not looking at that so much, but it seems like the rest of the country is really sort of all turning red or pink and sort of encroaching upon us. And I think that the other fear that I have there in terms of how pandemics burn out or don't is that if you haven't moved into an asymptomatic population, such as youth, and they don't suffer the consequences so that they don't conform to the social distancing, the mask and such, the problem is that, you know, we've been the world source of pertussis for decades now, and it becomes a little bit harder to try to eradicate if it moves into that phase of a pandemic. So I'm a little bit nervous that the cases in the surrounding states are getting closer, and I'm a little bit concerned that the nature of it's changing as well.
Okay.
Right.
Did also, I want to say within the last week, maybe 2 weeks, we did shut down the testing center that was at the Lowell Cinema. So that's been
That
closed.
shut down?
Mhm.
Okay. I thought you could get it done at CVS.
So that was the drive-through center that was run by CVS. It was coordinated through.
Yeah, I thought you could get it through going to the store. I've heard this, but.
You might be able to now. I don't think you could when they had that drive-through center.
Yeah.
I also know that locally here in Chelmsford, I mean, you could obviously get it done at Lowell General with, you know, with the doctor's order, whatever. Here in Chelmsford, the AFC, Urgent Care in Drum Hill, next to TD Bank, they will do testing as well. And that's probably the place. So we tell people, if we get a positive case it is now highly recommended by DPH that anybody who tests positive, if you're identified as a close contact, that close contact go and be tested, whether they have symptoms or not. If they test negative, it doesn't change the fact that they still have to stay in quarantine for 2 weeks. But it is encouraged that they go get tested. So we are, usually giving people as a Chelmsford resident saying that, if you call and let them know that you've been identified as a close contact, they will test you and you don't necessarily need a doctor's order. I believe you still need a doctor's order to go to Lowell General.
Okay. What about the nursing home? Or the
Knock
senior
on
facility?
wood, I have not heard much from them. They had a couple of more positive cases at Palm Center, but Palm Center was actually helping out other areas, and they were taking in people who they already knew were positive, and they had them on a separate wing in private rooms so that they could help out other areas for people who couldn't go home. And as far as all of granted, they did have their, significant impact in the beginning with their deaths, but since then, all of the patients from the very beginning have all recovered. And they did a recent testing again of the entire facility, and thankfully, everybody was negative.
Good, excellent, good news.
Yep.
Good news.
So the AFC urgent care, is that a Abbott immediate test, or is that a 1 to 2 day test?
1 to 2 day.
Okay, so it's PCR also?
Yes.
Okay.
All right, anything else regarding the COVID, the old business?
No,
No.
I think the other thing, and Dr. Miko alluded to this, when he was talking, I think the biggest thing is that because we're starting to open up different things right now, people are excited about that, and, rightfully so. But I think we need to, from a public health perspective, we really need to stress the fact that people still need to pay really close attention to, washing their hands, don't touch your face, and wear your mask, because you are protecting other people from you when you have that mask on. And I think as a society, we're getting a little bit more relaxed, and we're excited because different things are opening, and we're forgetting those things. So I really want to stress that to people.
It appears so, and of course, we're close to New Hampshire, and New Hampshire residents are not wearing masks
Right.
predominantly. I don't think they've been told they have to.
Mm-hmm.
So when you venture up shopping up in New Hampshire, it gets a little more dangerous.
Yeah, exactly.
Yeah.
Exactly.
All right, can I get a motion to accept the old business?
Motion to
Motion.
accept.
Second.
Eric, and
Second.
Hey, Richard.
Yes, second.
any further discussion? Can I have a vote in support of the old business? All in favor? Aye.
Aye.
New business. First new business is election of offices. And so I am going to suggest the following slate of offices. Eric as the chairperson, Rick as the vice chairperson, and I guess I will take the clerk's position, or the secretary's position. I'm not sure what we call it.
Clerk.
There are the ballots, gentlemen.
I think it's fine with me.
Eric?
I'm trying to figure out so that this will be different than what we normally do. Am I going to be up next year already?
No, I'm up.
Okay, because normally you will be the chair, except you've been just chair in perpetuity.
Yeah,
Here
Right.
to go.
that's what we said. I need a break.
Okay, so that to go over this again, I'll be chair, Richard will be vice chair, and you'll be the clerk?
Yes.
Okay. In favor.
All right.
Yes, I'm in favor too.
All in favor? All right,
Aye.
congratulations.
Thank you. Whatever.
To me.
We forgot to say no.
Yeah, that's
Um,
okay.
We then have to appoint our employees as agents of the Board of Health, and this has to be done every year.
Right.
So Sue, we will be appointing you, Mark, Michelle.
Darcy,
Okay, and anyone else?
Amanda, and Donna.
Okay.
How,
Donna becomes an agent too?
Yep.
Okay.
how long has Darcy been in that role?
What'd you say, Aaron?
How long has Darcy been in that role as public health nurse?
Since March.
March. And are there any unfulfilled positions?
No.
Okay.
All right, so I'll make a motion to appoint the Board of Health employees as agents of the Board of Health in accordance with Mass General Law, Chapter 111, Section 30. Is there a second?
Second?
Any further discussion? All in favor?
Aye.
And the next thing on the agenda is the spring town meeting, which I did attend in one capacity representing the board and another capacity representing myself. I did go and speak to the, I think, is it Hall, Mr. Hall? Sue?
Yes.
Yeah.
Mr. Hall's warrant article for some testing up and around the Westford asphalt plant and the Chelmsford asphalt plant. And I did speak in support of that, although I did need to correct some of the errors in misstatements in his presentation, which I thought, he didn't really need to do that because we were right behind him on wanting this done. I think the testing is a good thing. I don't expect they'll find anything yet, but at least we will have a baseline, and I think that's very valuable to us. Richard, were you there for that vote?
I had walked in, yes, just at that point in time, yes.
Okay, so they did allocate the $50,000 to have those studies done. There then was a second warrant article on to expand the number of individuals on the Board of Health from 3 to 5. I know we had never taken a position on that, so again, I was speaking on my own behalf at that point, and I discouraged it. I thought it was politicizing the board. We have difficulty getting good people to run for the 3 positions we have. The end result would have been the selectmen would have been appointing 2 individuals every year. Which puts us under the control of the selectmen, or the select board, and I really believe the Board of Health needs to continue to be autonomous. We should not have any board in a position, even remotely or tangentially, that can come in and influence us. And that the town meeting representatives did vote that warrant article down. Richard did speak about the history of the size of the boards, why some of the local boards have been going up to 5 members, and Richard pointed out that it's because the population of those communities is expanding, where Chelmsford's not expanding at the same rate. Is that correct, Richard?
Yes, correct.
Okay.
And also too that, my history with all the different boards across the state is that the most stable and most non-political boards that exist out there among the hundreds of active boards have been the 3-member boards, not the larger ones. It isn't that there hasn't been exceptions, that there are a few other boards that are out there that have done, but the best that are out there are the smaller boards, the non-political boards, and in my 40 years being involved with the Board of Health, when I was in Winthrop, 3-member board. And Winthrop has been the same population for 50 years too. So the idea of changing because some other board decides, and it was good to see that other parties did also speak up against it. So.
Right, I think too, the warrant article followed a review of the town charter, and there was a lot of discussion of why it wasn't brought up at the town charter.
Correct.
They had just gone through it. I think the three-person board's working fine. I think that every year we do get good people that do run to the position, people that want to be in this position, people that understand this is a difficult board to be on. So I think that we're doing fine, and I think it was unnecessary for that to be voted in, and I'm thankful that town meeting did support with, you know, the denial of that. Other than that, everything in that town meeting was going very smoothly. They run a nice meeting.
Yeah.
Very nice meeting. All right. Anything else, Sue? You have your reports? Anything that we should know in any of the reports from you or Darcy, Amanda, Michelle?
No, basically the majority of everything that we're all doing is really COVID related. You know, although now, like I said, we're getting into the, you know, the mosquito stuff. So, and, you know, I did participate in a webinar about, you know, ticks. And of course, we do have a couple of summer camps that do plan on opening for the kids. So we are inspecting those and making sure that they have 2 sets of rules this year. They have their whole, you know, community sanitation, recreational guidelines for camps for kids that they have to go by from the state. And then on top of that, there is a whole separate set of COVID guidelines that they have to go to. So it's not easy for them to comply with all of the requirements. I know, like, for example, Camp Paul was going to try to open, but they just couldn't possibly do it with all of the specifics as to what they had to do. We did open up a tennis camp, which is a little bit easier because of their distance. So they were able to comply. And I believe it's this week that even, like, you know, as far as the sports and all that, I think the kids can actually start having baseball games this week. So, you know, like I said, there are some people, they do not have to submit their plan to us. We're getting emails from a lot of people where I think they're interpreting that they have to submit stuff to us prior to opening, and they don't. They just have to go by all of the guidelines. And we would only get involved to follow up on the complaints if they're not compliant. And then if we follow up, we can ask them to see their guidelines, and they have to show it to us.
But Sue, the daycares had to submit their plans to the state before they could reopen. Is that a different situation?
Yeah, so they fall under a different jurisdiction.
Okay.
So now the daycares, as far as their communication with us, you know, they had to submit their plans and comply with that state entity. But if they have a suspicion of a positive case or a probable or a contact or whatever, then they have to contact us and collaborate with us on how to treat that individual situation.
Okay. Do you know how many daycares have opened in town?
I don't.
Okay.
It's funny, I got an email from someone today asking me if I knew how many, but they're not obligated to tell us.
Right.
There have been a couple that have been open all along because they've been for essential workers.
Yes.
At least 3 that I know of that have been open all along for essential workers. Now, how many of the home daycares or the private that will open? I think they'll open pretty soon, especially if parents, you know, are working full time. Some people are going back into the office and they need their daycares.
Yeah, absolutely. All right, any further discussion about the monthly reports?
Quick question about Mark's report. Under Jimmy's Pizza, he had informed them there was a $300 per violation per worker fine, but that's the only one he mentioned the dollar figure. Is there a reason that they already had a complaint?
Yes. So he was following up on a second complaint from people about their workers not wearing masks. Mm-hmm. And he essentially said, this is the guideline, this is the requirement. If we get another complaint, you will be fined.
But we've only had to have one escalation in this process so far. So that's, you know, in the couple of weeks it's been that they've been open. So I guess that's good.
Mhm.
And with regard to the police, I know it's not one of the reports, but the police, there was a concern they had before we opened up the beaches, that they were going to be unable or be difficult to enforce the distance and such. Have we had any more comments from them, or have they had any more problems?
No, they are, when they do go by there, and, you know, as part of their patrol. They also know that, you know, we typically are not working on weekends, so if someone calls in and does follow up on a complain, then they'll send someone over, because there's no way that the lifeguards are going to be responsible for any of that. And at this point, like I said, we in our office haven't had that many complaints, and I haven't heard from Chief Spinney that they have had an excessive amount of complaints either.
Okay. And are there any other departments within the town that we've had to work with differently because of this?
Essentially all of them, because any meetings that we have, we're not doing any in-person meetings. Everything is Zoom. You know, even if we're in the building together, we're all in our own individual offices. So we're doing our social distancing, and, you know, if you leave your office, you have your mask on and that type of thing. So even working with the partners in the other departments, we're doing social distance meetings by Zoom. And if it has to be an in-person meeting, then, you know, everybody has masks, and we do the same social distancing.
Okay.
Okay. So our next meeting is scheduled for August 3rd.
So I know that we typically want to keep on schedule, and that's fine, but I just want the board to know that I am on vacation on August 3rd. So we can keep that meeting, and I can just ask Mark to attend that meeting. I thought about seeing if we wanted to push it out to the 10th, but I'm on vacation for 2 weeks, so I'm on vacation the 10th as well.
Yeah, I think I just assumed keep on, well, I'm not the chairman. Mr. Chairman, what's your pleasure?
So for that meeting, are there any particular issues that we think are going to be coming up?
I don't think so.
Okay. So I was going to say that if we're not foreseeing any particular issues and protests or anything like that, why don't we keep it to the 3rd, because that keeps the spacing. Otherwise, we're going to get kind of bunched up
Right.
with the September meeting. We're just going to run into somebody else's vacation. I'm not taking any more vacation this summer myself.
September, I could be the problem.
Run away.
All right, let's keep it, and you can ask Mark to attend.
Okay.
Okay.
And is the 6:15 time slot agreeable to everybody?
Yep.
Yes.
Have I ever heard why we chose 6:15 as opposed to 6 or any other time?
That happened years ago.
Yes, it did.
I think it had to do with someone's schedule.
Somebody got out at 6 o'clock and rushed over.
Yeah, it had to do with somebody's schedule, as I recall.
Okay.
I mean, we can change it. We can always go to 6 o'clock. I think, you know, it also had to do with when the building opened, because they do close the building at they were closing the building at like 4 o'clock or something. They had to come back and open it.
I was curious about the history, but I figure if it's one of those ain't broke, don't fix. Unless anybody has a problem with this, it's working now, and I don't want to change to 6 and find the doors locked when we all arrive someday.
Yeah.
So
Nope,
6:15,
sounds good.
August 3rd.
Okay.
Okay, sounds good.
Okay.
So I'll ask telemedia right away to put that slot in, because they're having a little bit, they're just getting, as you can imagine, they are incredibly busy. And a lot of their slots, I think in addition to our meeting tonight, I think they had 2 others that they had to try to coordinate with Zoom. So I'll have them put us on the docket, if you will, and get a Zoom meeting scheduled right away so that we're all set.
Okay.
Okay.
All right.
All right.
All right, thank you.
Motion to adjourn.
We need a motion to accept others first, if that's okay.
Motion to accept others. I thought I'd done that with reports.
Okay, I'll
Can I get
second
a
that motion.
Okay,
I'll
Eric.
make the motion. Okay.
Any further discussion? All in favor?
Aye.
Aye.
Now I need a motion to adjourn, Donna.
Well, first I wanted to thank Anne Marie because since I've been on the board, I think you've basically been the chair, the acting chair, continuously for about 6 or 7 years now, it seems.
It feels like 16.
So I wanted to
Thank you,
thank
Eric.
your mentoring and guidance and leadership in all this. It's
Thank
been very, very much appreciated. It's been a wonderful lesson as well. Thank you.
Appreciate that. I appreciate the nice words. Thank you.
Also, too, I'd like to thank both of you and the department and Sue and all the employees for the great job that they've been doing in this craziness.
Thank you.
That clearly it's been trying times, and I tried to stay in the loop but couldn't stay in the loop. So, but I'm very pleased with the board and how they handle all the adversity and also to all the employees of the department too. They've done a great job. So thanks again.
Well, we're looking forward to having you here with your wealth of knowledge.
Yes, welcome in Nicole.
We're out there. Yeah, there it is. Okay.
In that brain is all kinds of tribal knowledge, Richard.
Yes, we got to drag it out of them.
Yeah. Yeah.
Yeah.
Donnie, you need to start a file.
Yeah. File.
Richard's wisdom.
Mm,
All
that's
right.
all right.
So motion to adjourn?
Motion to adjourn.
Second?
Second.
All in favor? Any further discussion? If not, all in favor? Aye. All right. Thank you so much.